Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. This is Dr. Waqar from Child Health Matters. So, MRCPCH Clinical Exam, what are the expectations of RCPCH from you? What are the total marks and what are the passing marks in MRCPCH Clinical Exam? How many attempts you are going to give? And how many stations, how many examiners you will face, how many role players and the patients will you face on the exam day? And so how many attempts you are going to appear? So let us start. So expectations from RCPCH from you are that you should have a good communication skills. You should establish rapport with the children and the carer. So for example, you should have make the good rapport for with the candidate or the role player, with the role player or the patient while you are examining or you are taking history. You should have the style, or you should have a skill how to build a rapport and how to take a history and management planning. You should have an idea how you took the history, then how would you manage that child, or even in the clinical stations. So physical examination, it's very important, especially in the clinical exam. And clinical reasoning, why are you going to do this? Organization of the thoughts and the actions. So you are taking history and they give you the some presenting complaints and what question you should ask, and then you should organize those by your thoughts and your actions. And development, child development, that is a separate station of the developmental station. And acute illnesses, usually they are giving in the video stations, because emergency cases they cannot give you in the exam scenario. These are the video stations. Professional behavior and ethical practice, so these are the expectations of examiner, which examiner or the RCPCH wants from the candidate. So total 6 attempts you are going, you can appear in the MRCPCH. If you, unfortunately, if you fail 6 attempts, then you have to appear in the first part 1 of MRCPCH, unfortunately. And total number of stations are 10. It means you will face the 10 examiners. And total marks are 82. I will let you know in the next slide how they divide. In the pass marks are 62. So total marks are points or the score, whatever you can say, it's are the 82, and the passing are 62. But unfortunately, if you got the less than 52 marks or less than 52 points, you will be differ for the next diet. So you should have to skip one exam. So less than 52 marks are a score, you should have to skip one diet and you should have to prepare well before going to appear in the exam. So clinical stations and the marking system of the exam, and how in which station you will face the real patient and the role player. So there are total 10 stations, as I told you earlier. Before I'm going further, please subscribe my channel for the further videos and for the further knowledge. So before I'm going to start, please subscribe for the interesting videos. So history station, it has 10 marks total, and developmental station is the one, and it has the 12 marks. So history is 10, one station development, it is the 12 marks. And video stations are 2, each video station contains 6 marks, so it will be total 12 marks. And in communication, you have to face the 2 stations. Video and communication, you have to face the 2 stations, and in communication each contains 8 marks, so it would be total 16 marks. And in clinical stations, which usually all candidates are saying are the difficult, these are the 4 stations, and in these 4 stations, each station has the 8 marks, and total these are the 32 marks, the highest marks in all other stations. So in history session you will have the role player, and in developmental station you will have the role player plus the examiner who can be the role player after your history taking from the role player for the developmental assessment. And in video station you would have only examiner and the videos. In communication station you would have the role players, and in clinical station you would have the real patients. So these four clinical station you would have the real patients. So total these are the 82 marks, and you should have to get the 62 marks for passing. So each mark matters, each mark matters, so you should have to be very careful. So this was about the MRCPCH Clinical Short Guide Examination Day, and I will tell you in the next video that for which books you should have to refer, and for beginners, if someone is having passed clinical theory exam and after that they are going to appear in the clinical, what books you should refer and how to study. For example, they have the MRCPT, they have other for communications, so how you should read these books. So some candidates, they are very new and they are not aware, because many of you may have the notes as well, but these all notes are written from the books, and notes are very good and short and concise. You should refer the notes and the past papers as well, but the study material which is recommended, many questions you can find from them. So if you want to join my group, which is a WhatsApp group by the name of Dr. Waqar Ali Khokhar, by this number, which is 00968 just send a WhatsApp message to join the group for further guide, for any question, any query or further guide. And also you can email me with waqar.khokhar1@gmail.com. So before, the majority of candidates are failed in the exam or they are not succeed, the big reason is stress. And even though they have the good knowledge, and they are very brilliant students, very brilliant candidates, they have very best knowledge, but on the exam day when they have entered in the station, they have the exam stress. So how to remove this stress, and how should you should be have the confident? For this reason, you need a mock exam. So I am conducting the online mock exam. If you are going to appear in the exam and you already accepted for the exam, so it's my advice, strong advice, not only my advice, for actually for all doctors who has passed, there a strong recommendation that you should have at least one or two mock exam before going to appear in the exam. It will make you more confidence, it will give you more confidence, and your stress level can be decreased by to attend the mock exam. Thank you very much. If you have any query or any suggestions, you can write in the comment, and please subscribe my channel for further videos as well. Thank you so much.